When a household is experiencing food insecurity, that means that members are worried they might run out of food, or they might not be able to afford meals, or they skip meals, or they just don't eat enough. Approximately 50 million people in the United States are food insecure. More than 12 million children are. Thanks to the support of the Robert Wood Johnson Foundation, we're doing a two-part series focusing on the effects of food insecurity and food support programs on nutrition and health. Before we talk about fixing the problem, though, we need to talk about what food security is and why it's important. That's the topic of this week's Healthcare Triage. About 50 million people in the United States lack access to enough food to live a healthy, active lifestyle. It's been estimated that over 4 in 10 Americans will experience food insecurity at some point in their lives between the ages of 20 and 65. Food insecurity is measured by the USDA with a survey included in a food security supplement of the Census Bureau's current population survey. The supplement is sent to about 45,000 households who respond either negatively or affirmatively to statements like, "Did you ever cut the size of your meals or skip meals because there wasn't enough money for food?" And "Did any of the children ever not eat for a whole day because there wasn't enough money for food?" Based on these survey responses, houses are assigned to high, marginal, low, or very low food secure groups. Because the survey has been sent out every December since 2005, we can see how people change their responses over time. Before the beginning of the Great Recession at the end of 2007, food insecurity in the United States was present in approximately 11% of all households and around 18% of households with children. As the recession really got going, those numbers increased to about 15 and 23% respectively. And though rates stabilized again following the end of the recession in mid-2009, they did not decrease back to pre-recession levels. Some people are more likely to be food insecure than others. Those who earn low incomes or who have less education tend to have more food insecurity, as do single adult households. Other associated factors include households headed by younger people, African American or Hispanic people, and renters as opposed to homeowners. Households with children are also more likely to experience food insecurity than those without children. Though we're still trying to understand the specific causes of food insecurity, it comes as no surprise that job losses and drops in income are triggers. Otherwise, a number of factors have been associated with risk, particularly in children. The rate of child food insecurity is lower than the national average in places like the upper Midwest and the Northeast, while they are highest in the South and generally higher in rural areas, both of which tend to have higher rates of poverty. While we know that increased income reduces food insecurity risk, we also know that rates of food insecurity are high even in homes well above the poverty level, and that well over half of food-secure children live in houses close to the poverty line. Data on factors that are protective against food insecurity suggest that assets such as home ownership, savings, and access to credit significantly diminish the effects of low income on food security levels, as does living in areas where food and utilities are less expensive. We also have data on other factors that appear to be involved. According to the 2014 Future of Children report from Princeton University, food insecurity in children is often tied to caretaker characteristics such as physical and mental health, substance use, experience with intimate partner violence, current or former incarceration, and education level. Children living with a disabled adult are 3 times as likely to be food insecure than their peers. Likewise, the risk of food insecurity increases between 50 and 80% in children in households with mothers experiencing moderate to severe depression. Families of children experiencing low food security also report significantly weaker social and emotional support networks. Somewhat along those lines, marital status has been implicated as a potential contributing factor. Children living with a single parent or a parent living with another relative or cohabitating partner are more likely to be food insecure than peers living with their biological parents, particularly if those parents are married. For children whose fathers do not live in the home, data suggests that food insecurity risk decreases when the father provides consistent financial or in-kind household support. Type of childcare and immigration status are also relevant factors. Children of mothers born in the United States are significantly less likely to experience very low food insecurity when compared to children of mothers born outside the United States. In seniors, food security status is affected by similar factors, including low education, minority status, social isolation, and health problems. Why is all of this important? Because eating, and eating well, is necessary for health. Food insecurity is associated with both nutritional and non-nutritional effects in children and adolescents. These include poor health status, poor school performance, poor mental health, and poor social skills. In non-senior adults, many poor outcomes are associated with food insecurity. These include physical health issues like diabetes, hypertension, and hyperlipidemia. Pregnant women who are food insecure are at higher risk of iron deficiency, and food insecure mothers are more likely to report oral health problems. Food insecure non-senior adults also report increased rates of depression. This is particularly true in mothers, who are more than twice as likely to report mental health problems when food insecure. In seniors, food insecurity is associated with a decrease in nutrient intake, lower health status, and increased depression. It can also cause limitations in activities of daily living that make seniors function like they are much older than they really are. Though results are mixed, some studies also suggest that even obesity is related to food insecurity, perhaps because high-calorie, less nutritious foods tend to be less expensive. A 2007 review published in the Journal of the American Dietetic Association concludes that while data on food insecurity and obesity in children are inconsistent, evidence is much more suggestive of an association in adults, particularly in women. Even beyond the obvious nutritional deficiencies that can result, food insecurity can also contribute in indirect ways to poorer health. Food insecurity is stressful, and stress is associated with mental health issues. Some theorize that this stress may also contribute to diseases such as diabetes through the release of the stress hormone cortisol, which affects fat storage. And of course, people with chronic diseases who have to adhere to specific dietary recommendations clearly will have much more difficulty doing so when they are food insecure. This only compounds the problems they may have due to diabetes, heart failure, and a host of other long-term medical issues. A study published this month in the Journal of General Internal Medicine supports this idea. Increased food security and reduced hypoglycemia were reported for food-insecure diabetic individuals following the delivery of medically tailored meals. To be fair, much of this data has significant limitations. We clearly aren't going to run randomized controlled trials on food insecurity, and therefore much of the research in this area is observational by necessity. Therefore, despite these proposed mechanisms, it's important to note the difficulties in understanding the arrow of causality in most of these relationships. For example, it's difficult to untangle whether food insecurity leads to depression or vice versa, or if the two are a result of some other factor, such as physical illness. But in any case, we all know from research and common sense that lack of access to food is not good. Thankfully, we have some safety nets for this, many of which try to address the problem early on by providing support to food insecure families with children. Even then, they're not perfect. That's the topic of next week's Healthcare Triage. If you enjoyed this episode, you might enjoy this entire playlist we've got on social determinants of health and why they're important. And if you want, you can support the show at patreon.com/healthcaretriage. We'd especially like to thank our research associate Joe Sevitz and, of course, our Surgeon Admiral Sam.